Hi my dear students, so I am here with the new topic, levels of prevention and modes of intervention. So in the last classes we studied about concepts of prevention in general, where we discussed what is prevention, what are the goals, what are the goals of prevention, what is the objective of the prevention, how the prevention program becomes successful, and then we named the different types of preventive levels. Now let us see in detail the levels of prevention and modes of intervention. As you can see here, there are 4 different levels of prevention: primordial, primary, secondary and tertiary. So prevention in its true sense is nothing but primordial prevention, and primary is the one which is applied when the primordial level fails, and secondary is the further above, and tertiary is the last level of prevention which is applied. Let us see in detail one by one. My dear students, I hope you remember we studied the natural history of the disease, where we mentioned the different levels of prevention. If you see this diagram, in the period of pre-pathogenesis, you are going to apply which 2 levels of prevention? Primary and primordial. Whereas in period of pathogenesis, you are going to apply which levels? Secondary prevention and tertiary prevention. And as we can see here, what are the different modes of intervention listed? In primary, and which is not mentioned here, in primordial, we do a specific mode of intervention which is called health promotion. And in primary prevention, there are 2 modes of intervention: health promotion and specific protection. In secondary prevention, there is 1 mode of intervention which is called early diagnosis and treatment. And finally, in tertiary prevention, we have another 2 modes of intervention: disability limitation and rehabilitation. So what are the different levels of prevention? Primordial, primary, secondary and tertiary. What are the different modes of intervention? Health promotion, specific protection, early diagnosis and treatment, disability limitation and rehabilitation. Now shall we see one by one? Let's start with primordial prevention. What is primordial prevention? Prevention in its true sense is primordial prevention. How do we bring about it? It's by using a mode of intervention called as health promotion. Because in primary prevention as well, we use health promotion, I would like to club together primordial and primary prevention. In primary prevention, what will be the mode of intervention? Health promotion and specific protection. In secondary prevention, early diagnosis and prompt treatment. In tertiary, disability limitation and rehabilitation. What is primordial prevention? Prevention in true sense, it is prevention of emergence or development of risk factors in the community. Please observe, risk factors in development itself is prevented. So it is a prevention of emergence or development of risk factors in the community. Here, mode of intervention is applied to whom? It is applied to individual and mass education so as to bring change in their behavior. For example, you know that smoking leads to lung cancer. If you avoid smoking, you can prevent lung cancer. It's not that you have started it and left it. There is no emergence of risk factor at all. Mean to tell, you are avoiding smoking. Okay. So to see to it that you will not be prone for lung cancer. Another example which we have seen here is avoid smoking and overeating and performing the regular exercises to prevent the coronary or cardiac diseases or coronary heart diseases. This is one more example for primordial prevention. We have to observe one thing: if you are already a smoker, you leave it. It doesn't come under this primordial prevention. You avoid smoking, you avoid overeating, you perform the regular activity, regular exercise, then with the motto to prevent the coronary heart disease, then it comes under the primordial prevention. So it is the prevention of emergence or development of risk factor in the community. So you can apply it either in the individual level or in the mass level. So to see to it that risk factor itself is not developed. And when this fails, we go for primary prevention. What is the primary prevention? What is its definition? As you can see here, It is the action taken prior to the onset of the disease which removes the possibility that a disease will ever occur. Are you understanding? You fail to remove the risk factor. Risk factor is already there, but there is no disease. Risk factor is there, but there is no disease. So, you are going to take action prior to the onset of the disease which removes the possibility that a disease will ever occur. This particular stage of prevention or level of prevention is called primary prevention. So, what is the key point? It is the action taken prior to the onset of the disease. If you can go back and remember the diagram of natural history of the disease, where was primary prevention? Yes, it was under the pre-pathogenesis period. What does it do actually? It will stabilize the epidemiological triad, agent, host and environment. What is the best example for this? Prevention of low birth weight by giving good nutrition. This is one example. Another example is prevention of hypertension by limiting the salt intake. You are not avoiding the salt, you are taking the salt in your diet, but you are limiting its usage in order to avoid the development of a disease. Which is the disease? Hypertension. This is an example for primary prevention. If it was primordial prevention, you would not have taken salt. If it is primary prevention, you are taking salt, but you will limit its intake. So, to see to it that you will not develop hypertension. Now, let us see what are its advantages. Yes, it is safe, it is cost effective, it has long lasting effect. What are the approaches? Again, you can apply it to the whole community, which is called mass or population strategy, or there is another strategy, it is called high risk strategy. What do you mean by high risk strategy? You will concentrate only on the group of people who are at high risk. As we quoted earlier, example, children less than 5 years of age, you give vitamin A prophylaxis to them to avoid vitamin A related diseases. Okay, so that is a high risk strategy. Okay, so I hope you got to know the definition of primary prevention. What are the different examples? What is its role in the natural history of the disease, early pre-pathogenesis stage, not the early stage, pre-pathogenesis stage. What are its advantages and what are the two approaches? Now, let us see the two modes of intervention which are used to bring about the level of first two levels of prevention. As you can see, health promotion is used in first two levels, that is primordial and primary prevention. It aims at improving overall activity of life. How is it brought about? By giving health education regarding a particular disease. That is, for example, the mode of the spread of the disease is taught to the people. For example, you know that there is something called a sanitation barrier which has 5 F's: finger, fomite, feces, foot and finger, fomite, feces, food. So, all these are going to, if you are taking care of all this, it is definitely going to prevent the occurrence of few diseases like typhoid fever, paratyphoid fever, acute gastroenteritis, etc. So, cleanliness is more important. If you take care of these 5 F's, then it is definitely going to cut the chain of the disease. So, it is a sanitation barrier. If you teach to people how to bring about it, what are the different modes of spread of disease, if you educate them, it becomes one of the mode of health promotion through health education. Then, different environmental modifications are example of health promotion. For example, safe piped water supply, construction of sanitary latrines are examples for environmental modification. Then, you can do nutritional intervention. You can use various programs, for example, vitamin A supplementation program, or you can to prevent anemia, you can you can educate them to how to prepare various foods using green leafy vegetables, iron rich foods, etc. So, nutritional intervention. Then you can bring lifestyle and behavioral changes in them. For example, if they are already smokers, you teach them that it can lead to lung cancer and you stop and you ask them to stop smoking. So they stop smoking, it is a lifestyle or behavioral change. Another is a marriage counseling. This is an example in case to prevent the genetic diseases. Then sex and population education. Then application of principles of genetics. This is nothing but to avoid the consanguineous marriage and to avoid the genetic diseases. Doing regular medical checkups in order to see whether there is any appearance of disease. Okay. So these are the different modes of health promotion measures which are used under two levels of prevention. One is primordial, another is primary. One more is there, that is specific protection. It is nothing but a specific measure which is used that offers the highest degree of protection against a single specific disease. For example, you give a vaccine to prevent a particular disease, BCG for tuberculosis, DPT for diphtheria, pertussis and tetanus. So like this, you are doing something called immunoprophylaxis to see to it that you will protect the particular person from a particular disease. One more example, nutritional prophylaxis. For example, vitamin A and iron and folic acid to prevent vitamin A deficiency and anemia respectively. Third one is chemoprophylaxis. For example, if you are going into a malaria endemic area, then you may take you may take the treatment prior in hand and then you may enter that area. For example, you take chloroquine and then go to malaria endemic area. So that becomes an example for chemoprophylaxis. Other examples are cholera, plague and anthrax. So if you want to protect against some occupational hazards, you may ask them to use some personal protective equipments like goggles, wearing gloves, gum boots, etc. So that also becomes the specific protection measures. Protection against carcinogens like wearing lead aprons can avoid the carcinogenic effects. Then taking care of allergens. Then prevention of food adulteration. These are various examples of specific protection. So one small recap, in today's class we studied first two levels of prevention among the four, that is primordial and primary prevention. Primordial before the appearance of the risk factor, primordial after the appearance of risk factor but before the appearance of the disease. Then we said there are two modes of intervention which is applicable for the primary level of prevention, health promotion and specific protection. Health promotion is applicable also to the primordial level of prevention. In health promotion, you have various methods like health education, lifestyle or behavioral changes, nutritional intervention, environmental changes, etc. Whereas in specific protection, you have immunoprophylaxis, chemoprophylaxis, then you have nutritional prophylaxis which can be done, and you can also think of protection against some occupational hazards, protection against some carcinogens, then allergens, also prevention of food adulteration. In the next classes, we will study the next two levels of prevention, namely the secondary and tertiary. Also, we will study the other two levels of modes of intervention. Thank you.